Welcome back to GTU. This National Kidney Health Month, we are assessing our risk for kidney disease with the help of Intermountain Health in this sponsored segment. Alyssa Buckley, a certified physician associate with Intermountain Health's Kidney Services in Murray, is here to help us understand our kidneys better. Good morning, Alyssa. So happy to have you here.
Good morning. Thank you for having me.
Okay, Kidney Health Month. That's
Yes.
March, so an important conversation to have.
Yes.
Let's just start simple. Remind us where the kidneys are in the body, where we can kind of get that sense and the function.
Yeah, absolutely. So our kidneys are actually just about fist-sized organs, and they'd be located, more so in your mid-back. And they're actually very important organs. They're responsible for filtering our blood of waste. They regulate our fluid levels in the body. They regulate electrolytes, and they make hormones that are very important for the creation of red blood cells, as well as maintaining healthy bone health. And without our, kidneys function, if they were really to stop functioning, patients would really need dialysis or a kidney transplant in order to live.
Hearing that is so shocking because you don't maybe think about it if you haven't had any issues or if you don't know you're at risk for something. So hearing all that they do, little organs, but so important to take good care. Okay, so let's talk about how we assess for that disease and maybe some underlying factors we can look for as well.
Yeah, absolutely. Well, I was going to say, so Intermountain has actually just developed something called a kidney risk score. And this is a lab order that patients can get done through their primary care providers. And that entails blood work and a urine sample. And the blood test is going to check for your creatinine levels. The urine sample is going to check for the amount of protein in the blood. And that can help with assessing, what is your 5-year risk of developing kidney failure. So that's a great test that patients, who have risk factors for chronic kidney disease, should be getting done annually with primary care providers.
And that seems easy.
Yeah,
an easy test to go and do.
Absolutely. Yes.
Yeah. So right here, some of those risk factors look like what you're seeing on your screen. So high blood pressure, diabetes, heart disease, autoimmune disease. What else should we look for?
Yeah. So, again, certain genetic diseases, obesity, smoking, anatomical defects that patients may have been born with.
And what's really interesting here is that some people have a disease or an underlying issue and they don't even know. There's kind of a big number who might say, oh, something's going on and have no idea. What are some of those early warning signs or symptoms?
Well, actually, so chronic kidney disease usually is a silent disease, meaning that patients won't have any symptoms until very late stages, such as chronic kidney disease stage 5. But signs to end up looking out for: if patients were to develop very foamy urine, blood in the urine, if you're developing swelling, if patients are becoming, nauseous or developing new heart symptoms and, things like that. But again, thankfully, though, that is usually towards the later stages of chronic kidney disease.
And what happens if somebody does come in, something is starting, how is that treated?
Well, I was going to say, so we would start out by trying, again, look for, what are the causes that's causing someone to develop chronic kidney disease. And, if we're able to detect it's coming from diabetes or high blood pressure or heart disease, of course, we'd recommend that these conditions get managed, appropriately. And we try to educate patients to make sure that they're remaining, well hydrated. They're avoiding medications that are known to be harmful to the kidneys, such as ibuprofen, Motrin, Aleve, that they're always trying to maintain a healthy weight, continue exercise, and, always talk about supplements to primary care providers and, their providers as well.
So much to learn about what to avoid, what to do. Any last tips for just keeping our bodies, regulated, healthy, and keeping those kidneys doing what they should be doing?
Well, yeah, again, so given our main risk factors for chronic kidney disease, can usually be controllable or preventable. Just always trying to make sure that you maintain a healthy lifestyle and healthy diet, I think, can try to, prevent a lot of causes of chronic kidney disease.
Perfect. Where do we go for more information?
Yeah, so, we can end up, talking to Intermountain's website, and also the National Kidney Disease websites, to be able to find out more information.
Perfect. We will link to all on our website and keep having that conversation during Kidney Month. Thank you so much for spreading an important message today.